Hi, I'm Dr. Ashley Fuller.
And I'm Dr. Meredith McClure.
And this is Labia Logic,
the podcast that's all vulva, no filter.
We're here to talk about all the stuff your doctor rushed through, the questions you've been too embarrassed to ask, and the sex ed that barely mentioned the vulva.
Because too many people are suffering in silence with painful sex, menopause misery, and vulvar issues no one talks about.
No shame, no stigma, just real talk, real answers, and the education you should have gotten in the first place.
Hello.
Hello, and welcome back to Labia Logic.
We're excited to talk to you today about bumps 2025.
We are going to talk about bumps. Because I don't know about you, Meredith, but I have a lot of patients that send me messages, probably at least one a week, saying they found a bump down there or a lump, and they're worried about it.
Typical scenario, you're washing in the shower or you go to the bathroom and you wipe and all of a sudden you feel something, maybe it hurts, it stings a little bit, and you investigate further and you realize, oh my God, there's a bump.
Right.
So,
or you feel it and then you're like, this must be a pimple. And then you start trying to squeeze it and then it does start to hurt, even though it didn't start to hurt the first time. Maybe that's just, I'm just talking for a friend. I would not do that. But.
Never. It doesn't get any worse when you start squeezing it either, does it?
Yeah. That tissue loves that. Well, so what we are going to talk about is what is normal down there, because I think, education is power. If you kind of know what normal changes in the skin and normal little bumps are supposed to be, then I think that's really helpful. So, it's not something that is abnormal. Then we're going to talk about benign bumps that are pretty common, that are not that worrisome. We'll talk about infectious bumps. And then we're going to talk about the ones you should worry about.
Yeah. And I think kind of the goal here is we just want to empower you. I mean, I know if anybody comes to see us in clinic, we're always pulling out our $8 Amazon mirror and showing people their vulva, because we don't want you to be alarmed by your vulva. And we want you to feel comfortable with what's there, what's normal, when to be concerned, and just to kind of navigate these things that might come up and help you find the right path to getting help with these things.
Yes. You can get an $8 Amazon mirror at home. You'll look at your vulva yourself. And I do recommend you do that like once a month, because that's how you'll know what's normal, know the different variations in this texture of the skin, use your hands to feel like, this area feels like it has more bumps, that kind of thing. And so your baseline. If you don't look down there, we talked about this in other episodes, no one else is really looking down there very often. So you should know your baseline.
Yeah. I don't know about you, but mine came with a comb. I don't know why, but that's what it came with.
Your $8 Amazon mirror came with a comb?
Yes, it did.
Wow. Maybe don't use that down there.
But sometimes I will say I do have to use my readers when I look at vulvas. I don't know about you. But
oh, yeah. Well, we're not young.
You reach a certain age and you do need some magnification. So
yes, you do. Well, before we jump into these normal variations, I have to tell a quick story. Meredith and I, trained together in residency, and we had a intermediate care clinic. I think we called it the ICC. That was a OBGYN ER of sorts.
24/7.
24/7 OBGYN complaints run by yours truly, the residents. On the board, they would put the patients that are waiting in their main concern, and sometimes it would say KOV. And KOV meant not on vagina. Totally anatomically incorrect, because if you listen to our podcast, you know that a bump on the vulva is not in the vagina generally. Yeah. But we always knew that someone was coming in with something on the vulva if it said KOV on there.
And I think it was just when we realized we wanted to do this podcast on bumps that I was like, remember the KOVs? We had that so wrong and we didn't even think anything of it until now.
It was so ingrained in our culture to not use the word vulva, even in a residency, like we used it inappropriately. So it's very interesting, but we are out to change that. That's what Labia Logic is all about.
So let's talk about some normal things you can find on your vulva that are lumpy and bumpy.
So one of the things is Fordyce spots. So we talked about this a little bit in one of the other podcasts about anatomy, but there are little tiny like yellow and white spots that are probably in between the labia and even a little bit on the labia minora that are just part of your normal anatomy. And they're like just little sebaceous glands. And usually there's lots of them. So if you look closely, you'll see them usually in groups, and they'll be, not just one or two. There's usually a lot of them, and they give the vulva some texture to it.
They can be totally benign and not cause you any problems. You can feel them. They, like you said, they kind of live kind of between that labia majora where your hair grows and the labia minora, that little flap, and that what we would call a sulcus, which I tell people it's kind of like it needs to be like a crevasse. You should actually see that area. And if you look really closely, sometimes you can see these little dots, and they're typically white or yellow looking, but they can sometimes get inflamed. I actually just had someone yesterday who was having a lot of pain and was really trying to navigate, figure out what was going on. And I think that she was kind of getting some pain from those cysts getting inflamed. She also incidentally hidradenitis, which we'll talk about as well. But I think kind of it was kind of all just connected in a way. So
Yeah. So those, yeah, they can get inflamed sometimes or cause pain, or they can get infected. I don't see that all that often, but I do see these spots a lot. And I will say that, we've talked about how we didn't learn a lot about this in residency. None of the things I'm going to tell you about any of these bumps, at least these normal variations, we talked about very much in residency. But I still think it's important to know about them.
Yeah. And fun facts, you can get Fordyce spots in the mouth. My husband's a dentist, and we we and I both go back all the time. Like how there's so many connections between the mouth and the vulva and the terminology and the things, because it is such similar tissue.
Yes.
And
Yes.
it's really interesting. I'll say a procedure, and he's like, "Oh, well, we have that in dentistry," and I'm like, "Oh my god, we haven't gone to gynecology," but it's just weird, the overlap. But it is in fact the same essentially type of tissue between the vulva and the mouth.
Yes. Yes. And there's also dermatologic conditions you can get in the vulva that also appear in the mouth. So
Yep.
do another episode on those at some point.
So the next lumpy bumpy thing I think is really fascinating, and I think it can scare some patients, and even can scare providers and the people thinking there's really something wrong and I have an STI. It's called papillomatosis. It's a very normal, benign finding, and it's typically where I commonly will see it is the edge of your labia minora will kind of almost in a way look not like sawtoothed, but just you can see little tiny bumps on it. And a lot of people mistake that for genital warts.
I've had patients come to me as a referral from another clinician saying that they have genital warts and need to be treated. These are not genital warts. If you know what you're looking at, they don't actually even really look like genital warts. Genital warts generally are pretty whitened and look like a different color of the skin. These are like the same color as the rest of your skin. They're usually pink. They can be a little bit whiter, but they're not like starkly different in color. And there can be a lot of them. And I actually have had some patients that I've actually removed them because they were bothersome to them, because sometimes they can be somewhat large on certain people. Again, a lot of anatomic variations between women, but these are pretty common and they can be alarming to patients.
Yeah. Yeah. I've even had one time grow rather large, kind of like on a stalk, like almost like a little tether, and it twisted and the blood supply got cut off, and it was really painful to her. And it was just something we took off in the office.
I've had something like that also. But generally, not to scare you of these, generally they're just like, I almost want to say it's almost like carpet. Like it's just like lots of little like outpouching of tissue, but can look like warts, but not warts and not something concerning.
It's just one of the many, many variations of normal that exist in the vulva.
Yes. And then one of the ones I see so often, especially in my postmenopausal patients, these angiokeratomas. So these are little darker purple bumps, and they are little blood vessels. They're like the ends of blood vessels. Some people can have a lot of them, but as the skin kind of thins, as we age, we just tend to get more of these. So some people can have just one or two. Like I said, they can be a lot of them. If you scratch them, they can bleed because it is vascular. They generally don't cause problems. I don't generally see them get infected or get very large, but people can have a fair number of them.
I don't know about you, but when COVID started and people were all worried, there's like skin changes, there's like vascular things, like people were really worried about those from COVID. And
Oh,
I'm like,
really?
no, yeah, and these are normal. I don't know if you got that complaint, but I did a
Oh,
few
I did.
times. And like a normal variation, and they typically are very painless. It's normally kind of somebody just looks or feels and sees this thing, and then it's a panic because it's red or purpley looking, but they're actually very normal.
And then skin tags. Skin tags are pretty common in this whole area. Anywhere we have friction, like underneath our arms, armpits, and anywhere on the vulva, the groin, it's pretty common to get skin tags. You can get skin tags on the labia minora. I don't see them in the interlabial sulcus all that often, but you can get them closer to the opening of the vagina. Definitely can get them closer to the anus, around the perineum, things like that. But usually you kind of feel it's a skin tag because it kind of sticks. It's usually by itself. It's not usually a bunch of them, and it usually kind of sticks out more.
Yeah. To touch on tags, there's another kind of more towards the inner to the vaginal opening. We have hymen tags. We've talked about how the hymen it's this thing that everybody's is different, and it's never really like broken per se, where it was never open and it had to be opened. But there's several variations, and you might sometimes see just little flaps of skin just right at your opening of your vagina. And I think that's alarming to some people. And sometimes they can be larger, like after you have a baby, they might be kind of bigger due to hormone changes and things like that. But they are totally, totally normal. And they normally don't cause you any problems whatsoever.
Yeah, hymen can have tags also. You also can have anal tags, so little outpouchings around the anus. We're not going to talk about that too much, but definitely if they're bothering you, could see a colorectal surgeon to have removed. I think it's important too to think about just, as you learn your own body, that there can be asymmetry. Like sometimes one side of the labia is bigger than the other side, and sometimes you have more Fordyce spots or a little bumpy texture on one side than the other side, and that can all be super normal. Again, another reason to know your own anatomy, but it's not always perfectly symmetric.
Those are kind of all things that can just be normal, things we don't necessarily have to really do much about in the vulva when it comes to bumps. But then there are some bumps that are not like worrisome necessarily, like from a cancer red alert level, but they can be worthy enough for you to see your provider for. And one of those could be these things called epidermal inclusion cysts is the fancy term, or a sebaceous cyst, but I would just call it a white bump.
Yeah. So these are super common. I see these a lot. And yeah, a kind of white yellow bump that usually is, they're kind of hard. They're not painful generally, although they can get infected sometimes. It seems different than a zit, or a pimple, because a pimple is kind of more white. These are a little bit more like yellow in color.
Yeah, and pimples can be kind of red at the base and have like a head on it, but these are just like an outpouching of just white, it's yellowish material on the vulva. And if you ever were to pop them, what you will see come out is it almost looks like toothpaste, not like pus like a pimple would have.
Yeah, it's not liquidy. It's kind of more cheesy. I open these in my clinic quite a bit. I actually find this to be very rewarding or satisfying.
To each their own.
It's kind of like Dr. Pimple Popper.
It's totally Dr. Pimple Popper, like what she's popping on people's backs, that this is what this is.
Yes. And so I put like a topical numbing medicine on and let them sit for a little bit. And I take a scalpel and make like a paper. I always say it's like a paper cut on top of it, because usually the skin on the top of these are super thin. It's like one layer of skin. Make a little incision and then squeeze them out. They can come back, especially if you don't get the whole cyst wall out. I had a patient actually saw this week who had probably 20 of them, like 10 on each side, maybe even more. So some people can get a lot of these. We don't have any really good way to prevent them. There's nothing that people are doing to make them get them. It's just the way their skin is. There's a whole idea that taking baths, like warm baths, can help open up these pores so you're less likely to get them. But I don't know how effective that really is. But they are very easy to get rid of in the office. If you have just one or two of them, if they're not bothering you, I generally don't think you have to do anything about them. But if you have a bunch of them, it can be bothersome.
Yeah, for sure. Now, the next cyst is the bothersome cyst that can really cause people some problems.
And this is the cyst that everyone thinks they have when they write into me and tell me that they think they have a bump, is because if you Google bump on the vulva, it's going to come up Bartholin cysts.
Yes.
So your Bartholin's glands are glands that are in the vulva that secrete moisture and lubrication into the opening of the vagina. If you're looking at a vulva, they are like at 5 o'clock and 7 o'clock, kind of over there.
Yes. Just on the inside.
On the inside. Okay. So if these glands get clogged, they will create like an egg-like or ball-like cyst, and it will feel like you're sitting on a ball. It's more like a lump than a bump, because it's not something you feel on the outside. It's really kind of like something that it's like distending the labia majora, and it's really almost inside the vagina, even though it's, on the vulva.
And they can be big.
They can be big. And that's a cyst. So a cyst generally doesn't hurt. It's just clogged. When it gets infected, it can really hurt. These can be so painful. I've seen them be like 3-4 centimeters in size, maybe even more. Red. Patients can't sit. They can't walk. These can be so painful.
Mm-hmm. You see them trying to walk into clinic and you kind of know, oh, that's...
Yeah, you know what's happening. So if you have a bump that you feel on your labia, it is not a Bartholin cyst. If you feel like a bump, like a pimple, something that's like, small and sticking up, that is not this. This is like you're sitting on an egg. There's like a water balloon that someone put at the opening of your vagina, a small one. That's what this kind of more feels like when you say.
Yeah. And they can recur, like the cysts and even the abscesses can recur. And sometimes people need kind of minor surgical procedures to even do various things to keep it open and not let it get clogged up, or even some people will have even the whole gland removed in some scenarios.
Yes, one of my least favorite surgeries to do.
Yeah, bloodiest
Yes,
surgery in gynecology,
bloodiest
folks.
surgery in gynecology. There's a lot of blood flow down there.
There's a
So,
lot of erectile tissue right around that stuff, and that's where it
yes.
cannot be pretty.
Yes. So if you are someone who gets Bartholin cysts or abscesses, then I think it is one of the more painful things that happens to women. It's not super common, but it's common enough, and it can be hard to prevent recurrences. And again, the surgeries can be challenging, but generally once people have them removed, if they keep coming back, then it does obviously cure the problem. But generally that's a kind of a last resort.
Hmm. Yeah.
Why don't you tell us more about hidradenitis? That's something you mentioned before.
Hidradenitis suppurativa, or HS. So this is a skin condition that people can have, and it happens not just in the vulva, and it's not just female patients. It can be in male patients too. It's a condition actually with the hair follicle. And if you imagine a cartoon of a hair follicle, there's a big bulb at the base, and that has material in it, and it's an oily material that in hidradenitis will actually rupture that bulb, and that material gets out underneath the skin, and of course it's got to find its way out, and sometimes it will travel long distances to find its way out, and you get these like tracks, and it just looks like it's like a line of almost like a scar underneath the skin, like something's pulling the skin in a direction, and then they'll have this boil is what patients will typically tell you, and it's a draining abscess. They're typically sterile. They're not infectious. It's because this is from a skin problem, and they're quite painful, quite scarring and disfiguring, and cause a lot of psychological trauma for patients, because it typically happens in your groin. It can happen on the labia majora, because again, this is a hair thing, the armpits, and even under the breasts. And I feel so much for those patients, when we do their exams, and they just like, they'll kind of apologize, like, I have hidradenitis, and they're, apologizing to us, and you never have to apologize to us. But it's a very frustrating thing for patients to deal with, I would say.
Yes, you never have to apologize to us about not showering, not trimming your hair, about odor. We are here to help you, and we accept you however you are. So, but yeah, hidradenitis is a really hard condition, and it's hard to treat, and it can be very disfiguring and painful.
Mm-hmm. Agreed.
All right. I think we're moving on to infectious bumps. What do you think?
Yeah, I think that's great.
All
Let's
right.
do it.
We've already talked about one of them, so I'll start with that one, is genital warts. So genital warts are caused by HPV, but it is caused by a different HPV that causes cervical cancer. So there's like 100 different types of human papilloma virus, and there are, some that are high risk for cervical cancer, and then there are two strains that are more associated with genital warts. These are considered low risk. They don't turn into cancer, but they can cause, if you get them on the skin, it can cause like flesh-colored cauliflower, like verrucous-like growths. Sometimes they can be a lot of them. I've seen patients who have, their full vulva covered with little genital warts, and I've seen some people have just like one or two little spots of genital warts.
Yeah, and they can be around the anus too.
They can, yes, for sure. And they can be itchy. I think we talked about this in our itch episode. They can be itchy. They're not generally super painful, but they can be. But they're uncomfortable. And if you have a lot of them, it can be very disfiguring and very difficult to have sex, difficult to, deliver vaginally. And we definitely saw some of that in residency, patients who would have a lot of warts and then have to have a surgery before they could have a delivery, because worry that these can bleed quite a bit if they're torn, things like that. So,
and they are contagious.
They are contagious. This is my plug for the HPV vaccine. The HPV vaccine does have the two strains in it that prevent against genital warts. So if you're following vaccine guidelines, usually between 9 and 11, we vaccinate both boys and girls. It is helping to prevent genital warts. So actually, I don't see a ton of genital warts that often in my clinic. Definitely I do, but it's not that common. I think it will become less common as this younger generation that's been vaccinated for HPV kind of ages.
A plug that it is approved up to the age of 45 now. So, and I have so many patients who are like, well, I don't think I should get it. I don't need it. I'm with my one partner and this is it. But I also remind them that there's vulva cancer from HPV. And so this is even preventative for that. So
I tell patients, even if they're in a monogamous relationship, I say, you know what? You never know what life-changing events can happen to you, because I sometimes get patients in their 60s who have a new sexual partner for whatever life-changing reason. And they get HPV, like cervical HPV, and they're pissed about it. Like, why didn't anybody tell me I can get this vaccine? So it's only FDA approved to 45 just because that's who they've studied it in, but it's totally safe for everyone. I don't have any safety concerns about people who are older than 45 getting it, but you're more likely to get your insurance to cover it if you're 45 and under because that's what the FDA approval is for. But I highly recommend it. It is more effective if you get it before you've ever been in contact with anyone sexually. So that's why we try to give it to our kids, but it still could prevent any new strains of HPV.
Yeah. And if you have a history of HPV, cervical or even, genital warts and things like that, it does not preclude you from getting the vaccine by any means. A lot of people kind of think that that's something they can't get it if they have HPV, and that's absolutely not true. And if you do get it before the age of 16, it's 2 shots as opposed to the 3 if you're over the age of 16.
All right. Then let's talk about everyone's least favorite STI, herpes.
Extremely common.
Extremely common. I think we talked about this in one of our other episodes. So herpes is a, painful blister or ulcer. Usually there's like a prodromal symptoms, usually a little bit of itching that people notice. You usually kind of get it in the same place. But basically herpes is a forever virus. It lives in nerve endings. And the way I think about it is that your immune system is kind of holding that, virus back from having the painful blisters all the time. And during a time of stress, or if you get like a cold or a flu and I always think like the immune system's got to go take care of something else, then that's when you tend to get an outbreak. So people often get outbreaks around stressful times or if they're ill with something else, but they tend to get recurrent infections. And these are going to be little painful blisters. They start out as like clear bumps with fluid in them. And then those bumps will break open and kind of ulcerate and then kind of dry out.
Yeah. And it's extremely painful. If it's the first time you've ever had an outbreak and your body's never seen this virus before, it can be extremely painful.
Yes.
And swelling, and your lymph nodes can get swollen down there, and it can be really hard to go to the bathroom because it hurts so bad. So that's definitely something to seek guidance and care for sure. Also contagious.
There are some good medications on the market for antivirals you can take to prevent recurrence and also prevent asymptomatic shedding. So you can shed this virus even when you don't have an outbreak. So it is very, very contagious. But there are medications you can take daily to help reduce that. I wear another hat in my life. I'm doing vaccine research, and there's definitely companies looking to try to get a herpes vaccine to market. They just haven't found the right protein to target. It's a very challenging virus to get to and to prevent.
That's very interesting because I've got chickenpox, which are similar, but
yeah, it evades the immune system quite well. So that's one of the reasons it's kind of there forever. So hopefully in our lifetimes, we'll see a change in that, but stay tuned on that.
And you make a good point in that, I think some people think herpes is just contagious if you have the feelings of an outbreak coming, or I have an ulcer down there and I'm going to be fine once all that goes away. But there are people who don't have symptoms whatsoever and they shed. Basically, when you say that, it means that there's virus particles being released, and herpes is transmitted through contact. So even someone who has no symptoms could have virus there and be contagious. So it's just not to be scared of, but it is something to keep in mind.
Yeah. And then another bump you might feel down there is molluscum. So molluscum contagiosum is another pox virus, and it causes these little dome-shaped, usually painless little bumps. They look kind of more like kind of blisters. They're kind of clear. Usually they're dimpled in the center, and they can be really tiny or they can be a little bit bigger. They're very common, and like kids get them. So it's not really necessarily a sexually transmitted infection, although you can get it that way. Kids can get them on their arms, on their bodies, wherever. There's a couple different ways you can treat these. Generally, I think one of the things that works the best is just unroofing them. So I put a little numbing medicine on in the office and then just take like a sterile needle and kind of just take the tops off of it, and they will go away. But you can also there's some medications on the market. I don't use those as often, but this is pretty common. And again, not painful, but bumps that you might feel that look kind of more like almost like a blister with a little bump in the middle.
And it's caused by a virus, just like herpes and HPV, genital warts. I don't know about you, but both my kids had it. They go to preschool, they put their mouths and hands on everything and they get molluscum. It just happens. So it's not just a sexually transmitted infection. It can be kind of like, for my kids, it was a nightmare to try to get rid of, but it can also be just kind of self-limited. Just your body can also kind of figure it out and keep it from coming back. And so, my kids, I haven't seen any molluscum since. So
yeah.
Clearly their immune system has figured it out and it's not coming back, which, like you said, herpes is one that can come back, and HPV is another one that can as well.
Other things we haven't talked about that are infectious. I mean, sometimes we can get kind of like folliculitis. So folliculitis is like little pimples that you can get, but not usually is caused by some kind of bacterial infection. Sometimes those can get big, can cause boils or abscesses. vulvar abscesses are not uncommon. Of course, we talked about Bartholin's abscesses, but you can actually get abscesses anywhere on the vulva anytime you get an infected skin area. And those can be sometimes really, really painful. Periclitoral abscesses are my least favorite. Those can be so painful. But anytime you can get some bacteria kind of stuck underneath the skin around a hair follicle, something like that, you can get, infections. Sometimes we can treat those with topical antibiotics. Sometimes you need oral antibiotics. Sometimes you need to have it opened and drained. It can be different severities depending on how big it is.
Shout out to our old emergency room days and the KOVs, not on vulvas. Some people could be more predisposed to getting these big abscesses that go kind of astray pretty quickly. And so this is something that you need to be wary of. Like if you have diabetes, I don't know about you, but I've definitely diagnosed diabetes in someone via a vulva abscess because that was probably one of the reasons that she got it. And then other people whose immune systems are not up to snuff, I would say, kind of if you're taking medicine to suppress your immune system or you have certain medical conditions that make your immune system kind of at the lower end of functioning, it can predispose you to these as well. And these are definitely in those scenarios where you need to get treatment, sometimes even in the form of like intravenous antibiotics and a hospital admission to watch and make sure it's not getting worse because those things can get really, really bad and you can get a really nasty infection, not just isolated to your vulva, it can go elsewhere. And that's a really scary, dangerous situation.
Yes, you can get really sick from those, especially if you're compromised or have diabetes, for sure. All right. Well, I think we've covered a lot of the benign stuff, the infectious stuff. And now we're going to talk about the scary stuff. I will say that this stuff is not that common. That is the good news about this. Like, I look at vulvas all day, every day. So does Meredith. I really don't see these all that often, but it's good to know that these exist, know what kind of they look like, just so you're aware and can be on top of that. So you can get melanoma on the vulva. A lot of times when patients send me a message that they have a dark bump, I mean, usually it's the angiokeratomas that we were talking about before, but I always like to look at it. I often tell patients to send me a photo. It sounds like a weird thing. I always say, if you're comfortable with it, send me a photo. Photos are super helpful. We can put it in their chart. I can see it. They don't have to come in just to have me peek at this bump. But melanomas, we talk about the ABCDs of melanoma, right? Asymmetric, irregular borders, colors are kind of odd, and I don't know what the D is. Depth. See, I shouldn't be saying this. I don't know. I'm not a dermatologist. We've talked about that.
Yeah. Who runs the vulva?
Who runs the vulva? But so if you have a dark lesion, you should have someone look at it. It may just be an angiokeratoma that we talked about, but if it's changing, if it's irregular in shape, if one side of it's darker than the other, then those are signs that it's more likely to be something more serious and could use a biopsy.
Especially if you have family history of other cancers and especially melanoma, because melanoma can run in families and have kind of genetic things like breast cancers and ovary cancers and pancreas cancers. Like the melanoma does exist in the BRCA gene specifically, BRCA2.
Yeah, it's good to be aware of that kind of thing. And, dermatologists, we've talked about this, are doing skin checks. This is where you should have them look or have us look or be looking yourself for those kind of things.
Mm-hmm. Yep.
All right, let's talk about vulvar intraepithelial neoplasia, or VIN.
VIN or VIN. And there's actually two types of VIN. We weren't taught this, and I don't think it wasn't until I started hanging out with dermatologists that I realized that was a thing. So there's just VIN, which sometimes might be called like a HSIL or an LSIL, which is a high-grade lesion or a low-grade lesion. And this is from HPV-related changes.
Right. And these are precancerous. They're not cancerous.
Mm-hmm. And they do require treatment. It's normally diagnosed by a biopsy, by a vulval biopsy. And they can be a bump. They can be itchy spots or kind of like plaques in a way, like things like that you need to look out for. And then there's another kind of VIN, which we call differentiated VIN. And that is going to be from some of our skin disorders like lichen sclerosis that we'll definitely get into. But if not treated, some of our vulvar skin disorders, these autoimmune type skin disorders, can lead to precancer and cancer.
These tend to be more like patches of skin. So it's not usually a bump, although it could be, but usually it's like thickened white or red, and it's like usually a patch of skin. That's generally what I've seen. And yes, there's usually, oftentimes you either have HPV or you have a dermatologic skin condition that puts you at higher risk for this.
Mm-hmm. You can also get a tumor down there. Both of those two conditions, the one from HPV and then the one from the skin disorders, can lead to squamous cell carcinoma and that cancer of the vulva. And it can definitely be a big bump, tumor, have like an ulcer on it. These definitely warrant evaluation and biopsy and will end up needing a surgery.
Yes. So if you're having like a bump that's kind of scabbing and bleeding, then kind of healing and then unhealing, like kind of coming back, like or ulcerated area, these are things that you definitely would want to have someone look at, because those are things that could be way more concerning.
Yeah, especially from the HPV. Just another shout out to the vaccine.
Yeah, absolutely. Absolutely. And then you want to talk about Paget's disease?
I've seen it a few times in the vulva. When I have seen it, it was more an itchy spot for the patient, but it can look kind of bumpy, maybe feel a little bumpy. We kind of say it looks like strawberries and cream is kind of that classic dermatology term. It can be red with kind of some whitish within it, and that's where that strawberries and cream comes from. It's like a skin cancer that's like, it's not just necessarily a surface level thing. It can be deeper and it can go farther than what you're seeing on top of the skin. And there's various ways to treat it with, different surgeries. I know my vulvar dermatologist is really an advocate for even trying to get Mohs surgery for Paget's. It also happens in other parts of the body. It's most commonly known from a breast cancer standpoint. And this would be extra mammary or outside of the breast Paget's disease of the vulva.
Yeah, it's pretty rare. I think I've only seen it once, but definitely something to know about. Anything else that we should make sure we talk about in our lumps and bumps?
I think the biggest thing is, you're wiping and you find a bump, and like, what point do you go, oh my God, I need to call my doctor? I think that's probably the thing to really hit on.
I think if you feel a bump, you should get a mirror and look so you know what you're looking at. Hopefully, like what we've talked about has helped you. You can always Google some of these terms we've used, like Fordyce spots and papillomatosis, and there's some images you can find online. They're not that scary. And you can kind of compare. Obviously, if you feel like this is not normal for you, it wasn't there before, if it's really painful, if it's changing, those are things that I would definitely want you to reach out to your clinician to have looked at. And those are things that would worry me more. Also, if it's bleeding really easily, although there can be benign things that bleed, but obviously your vulva shouldn't be bleeding. So that's something you should be evaluated for.
Yeah. If this thing is causing you to have like a fever or anything like that, then that's definitely worth calling about. And then age also is something to factor into. If you are postmenopausal and you're in your 50s or 60s and you've got a bump down there, those could be worrisome and something that needs to be checked for sure.
The real big take home is always look and be reassured that most of the time these are nothing that are super concerning. But know your body. Don't be embarrassed to ask if you have something you're concerned about. We're always happy to look. I'm sure any of your clinicians would be happy to look. And knowing your body is really important. So that's the biggest takeaway, I think.
And you never have to apologize to us. We are not here to judge. And just the fact if you've gone through menopause, you're not getting periods anymore. You don't have a uterus, you're not getting periods anymore. You still need to have your vulva checked.
Yes. Yes.
On the regular, at least once a year, maybe once every 2 years. So many people don't get their vulva checked, and they should. And again, we need to be better as practitioners to look at vulvas.
Absolutely. Because there's after 65, the guidelines are you don't need pap smears anymore. So I think a lot of people don't go to the gynecologist anymore. And a lot of the primary care doctors, I'm not pointing fingers, but are not doing exams just because there's no complaint. And I really disagree with that. I really think that patients should have their vulva looked at. And even if I don't do a pap, I usually look in their vagina, look at their cervix, feel their uterus and ovaries, do a whole pelvic exam. I do recommend that once a year. We find things, but especially on the vulva.
Yeah, for sure.
All right. Well, hopefully this has taught you all about lumps and bumps, and you feel more empowered about your knowledge of anatomy and what's normal down there and what isn't. And thanks for being here, as always. Thanks for joining us for this episode of Labia Logic.
We get it. Sharing a podcast like this might feel a little taboo, but we're here to break down those barriers. Labia Logic's all about empowerment, not embarrassment.
If you found this episode helpful, we hope you share it with others who could use a little labia logic in their lives. Can't we all? You can find us on all major podcast platforms and connect with us on Instagram at labia_logic.
From our lips to yours,
Viva la vulva!